Sonoma County. Today, I'll be talking with Dr. Rachel Rees, Director of the Sonoma County Public Health Laboratory. Sonoma County's Department of Health Services includes the Public Health Regional Laboratory, and health professionals provide specimen testing services to the counties of Sonoma, Mendocino, Lake, and Humboldt in Northern California. Led by Dr. Rees, the laboratory provides training and reference testing to clinical laboratories and laboratory support for diagnosis and control of communicable diseases to private medical providers. Today, I am delighted to speak with Dr. Rees regarding the testing for COVID-19. Thank you, Dr. Rees, for joining me today, and thank you and your staff for the incredible work being conducted during this health emergency. We have a few questions for you. Actually, the community probably has a lot of questions for you, but we'll limit our questions to just a couple. Let's, first of all, take some time, introduce yourself, and then please explain the testing process for COVID-19.
Hi, thank you. Thank you for the opportunity to be with you today and talk about the Public Health Laboratory. My name is Dr. Rachel Rees, and I am the Public Health Lab Director here. I am from California, and I started out my career as a clinical lab scientist working in hospital labs, and then I went back to graduate school to become a public health microbiologist and lab director. I'll tell you a little more about what we're doing here at our Public Health Laboratory now during the COVID crisis. So the state and the county do have guidelines in place that determine who will be tested here at the Public Health Laboratory, and we are testing the persons at higher risk of having COVID-19 or at higher risk of contracting the virus. And these could be groups of people like persons in the hospital, people who are very ill, or healthcare providers that are helping to take care of these people, and first responders. The screening of who will be tested here at the Public Health Laboratory is done by our disease control unit, and there are a lot of disease control nurses working there tirelessly to make sure everybody is being taken care of. So I'll move on to the virus itself. COVID-19 is a virus that attacks the respiratory system. So once it's determined that someone needs to be tested for the virus, usually a swab specimen will be taken from the upper respiratory tract. And I have an example of one here. I don't know if you can see it. There it is. So usually they'll come in these little kits. It has a swab that doesn't show up very well because it's white. And then there's a liquid transport media there. So if you're being tested, your healthcare provider will take a sample of either your nasopharyngeal area, which is they'll go through the nose and back, kind of far up close to the ear. Or it could be a throat or a nose swab. And then once they take that sample from you, they'll put it into this liquid media. They'll break off the swab and put the cap on. And then it's ready to be sent to the laboratory. Once the samples arrive in the lab, the staff will unpack the samples in a safe manner. They check to be sure it's the right kind of sample, that it's not leaking, and that the patient information is accurate. Then the samples are entered into our laboratory computer system, and then they're ready to be in the actual testing process.
The second question I have is, what and how many tests are currently being conducted by the Public Health Lab related to COVID-19?
So currently we're performing one type of test for COVID-19 to determine if a person does have the virus that causes that disease. This test was developed by the Centers for Disease Control, and it's a type of molecular test referred to as RT-PCR, which stands for real-time polymerase chain reaction. So the samples will first undergo a genetic extraction process. Then the samples are placed onto the RT-PCR analyzer, and this will amplify any genetic material from the virus that's in the specimen. Then at the end of the run, if the virus's genetic material is detected, the sample is considered to be positive for COVID-19. But if no viral genetic material is detected, the sample is considered to be negative. Once we have reviewed the run and make sure all the quality control is within bounds and valid results have been obtained, we send the test results to the patient's healthcare provider, and then they will decide the next course of action for the patient. Our maximum capacity for this test is about 120 tests per day, which usually one sample comes from one patient, so it's 120 patients per day. We have been receiving more tests as time goes by. At the beginning of April, we were testing about an average of 44 per day, but this past week, our testing has really increased, and it's about 77 per day at this time, and we do test 7 days per week. We have another test system in the lab called the Cepheid Gene Expert, which is a commercial assay. So right now, we're using it to test for flu and tuberculosis, but it can also be used for COVID-19 molecular testing. We've ordered test cartridges and expansion modules, and once that system is operating at full capacity, it will just about double our testing capacity.
And I think that that's the question that so many people in the community have. Why aren't we testing more? What is our capacity for testing? And with the new antibody test coming forward, do we have the capacity at our public health lab to really ramp up our testing and test more of the folks in Sonoma County?
And that is a very good question. We are trying multiple different avenues to be able to increase our testing capacity. For one thing, we have been purchasing more sample extraction and testing units. However, many of the pieces of equipment we have ordered and the chemicals that are used to run those tests, and even the swabs and transport media to collect the samples, are really available in limited supply. There is a nation and global-wide shortage on many of these items. For example, some of the new equipment, like the Gene Expert modules that we have already ordered, they won't arrive until June. Fortunately, we have been able to partner with UC San Francisco to provide expanded molecular testing capacity to the community. UCSF is providing a limited time period of free testing, so we'd like to take advantage of that and get as many people tested as possible. As far as our staffing, which is another area, that can cause limitations in our testing capacity, the Public Health Lab has a team of 4 public health microbiologists, 2 laboratory technicians, and an office support person. Because we are so busy, we are hiring additional staff, and we've even borrowed staff from our Environmental Health Division. And this will help us increase our COVID testing capacity and maintain the types of routine testing that we are still doing in the laboratory. We're also working on making our digital technology more robust by implementing, one example is electronic test ordering and reporting. So if we can make that system available to people who are submitting tests to our laboratory, it will really decrease the amount of manual data entry that we're doing here in the lab, and it will make test results available more quickly and more broadly in the community. And I believe your other question was about antibody testing, and antibody testing is coming soon to our laboratory. We have just purchased a new analyzer. It's made by a company called Diasorin, and it's called the Liaison XL. And I'm hoping to have that arrive in early May. It takes a few days, I think, to validate before we're up and running, but I'm really excited to be able to offer antibody testing in-house. So antibody testing detects the body's immune response to the virus, whereas molecular testing detects the virus itself. So the 2 tests are used for different purposes. Molecular tests are diagnostic. They let us know if the person currently has the virus. Antibody tests, on the other hand, they help determine, they're part of the body's immune response, so they do help determine if a person was exposed to COVID in the past. And one potential use for antibody testing is to decide whether people can return to work.
Wow, I think we in Sonoma County know far more about pandemics and testing and the tragic consequences of the transmission of this virus. And now looking back in history, I really want to thank you and all of your staff. But what 3 facts about COVID-19 and how our tests are being conducted do you want our community to understand?
Well, I would like to share that our region is very fortunate in that we do have a highly trained and dedicated team of public health laboratory staff working to provide as much testing to the community as possible. We are making sure that we churn out high quality, timely, and accurate results. And so, when those results leave the lab and you have them, you're better able to fight the COVID-19 pandemic. So I would like to say to you to just keep washing your hands and keep doing social distancing, and together we can be successful in fighting the pandemic.
And wear our facial coverings now that the health order has come out. So in enclosed spaces, I want to let the viewers know that you and I are in enclosed spaces, and so we don't need our facial coverings. But if we were to go out into a grocery store, definitely.
That is true.
Thank you, Dr. Rees, for taking the time to answer these questions. We appreciate what you and your staff are doing at the Sonoma County Public Health Laboratory. This interview is part of my virtual report on COVID-19. Look for my virtual reports online at socoemergency.org or YouTube at youtube.com/official Sonoma County. And I think we may be checking back in with you regarding the testing as we go forward, especially as our new testing equipment becomes available. So thank you so much to you and all of your staff.
Thank you so much for the opportunity today. And if you have any other questions at any time, please feel free to contact me. And I look forward to speaking with you in the future.